Hello, my name is Jackie Dubois, and I am a certified nurse midwife out of Phoenix, Arizona. And today I'm going to be giving a presentation on pregnancy and childbirth in the U.S. So first off, who is going to deliver my baby? There are two different providers that could be delivering your baby. One of them is an OBGYN, who is a doctor. They go to medical school. They work only in hospitals. They are trained to handle high-risk pregnancies and complications. For example, postpartum hemorrhage, C-section, a woman that has high blood pressure or diabetes. These patients are better equipped to be dealt with a doctor. They can also repair more extensive tears and use instruments like forceps and vacuums to deliver a baby vaginally. They can also perform a procedure to flip or breech baby, which is called an external cephalic version, and basically they put their hands on the abdomen and flip baby into the head down position from the outside. More of OBGYN patients choose to get an epidural, and it is more male dominated. The other provider that could be delivering your baby, which is like myself, is a nurse midwife. Nurse midwives, they start out in nursing school and then they get a master's degree in nurse midwifery. They deliver a lot in hospitals, but they also can deliver in birthing centers or at the home. They are trained to manage uncomplicated, low-risk pregnancies. And it's a good thing to note that you may start out as a low-risk pregnancy, but if you develop any complications, you may be referred to a doctor. And like in my practice, sometimes we co-manage, so I can still continue seeing patients and do their deliveries, but I just have to work closely with the doctor to manage any of the complications. Midwives tend to use fewer medical interventions during childbirth, and they like to use natural approaches like massage, breathing techniques, aromatherapy, and positioning to open the pelvis. Typically, nurse midwives spend more time at the bedside. They repair less extensive tears. So if there's 4 stages of tearing, first degree, second degree, third degree, fourth degree. A midwife can repair first and second. If there's a third and fourth degree tear, they call their backup physician who will then come and help with that repair. Nurse midwives can assist doctors in surgery, so we can be in the C-section with the doctor as their first assist. Nurse midwives also tend to provide more education and resources during their prenatal visits, and it is more female dominated, though I did have 2 male midwives in my midwifery class. So routine appointments. Typically over throughout the U.S., this is kind of, I'm speaking for my practice, but I think it's pretty standard of care. You'll be seen every 4 weeks until 28 weeks, every 2 weeks until 36 weeks, and then weekly until you have the baby. You'll usually have about 3 ultrasounds. The first one is an early dating ultrasound that usually happens around 6 to 10 weeks. Gestational age, and that's just to check dates. Does your last menstrual period line up with the ultrasound dating? And it can be changed if it's not. Then you typically get an anatomy scan around 20 weeks where they look at all the parts of the baby, so the heart, lungs, kidneys, arms, legs. And then some practices will do a growth ultrasound around 32 to 34 weeks. Other practices might just measure the belly, and if the belly's measuring small or big, then at that time they would do a growth ultrasound. Blood work is done in the beginning of the pregnancy to look at your blood type, any infections in the blood, see if you have low iron. And then again around 26 to 28 weeks, you would have labs to check for gestational diabetes and also again check for anemia or low iron. And then in the 3rd trimester, I encourage a lot of my patients to do childbirth ed classes as well as breastfeeding classes if this is your first baby, or if it's your first baby in the United States, it might be a good idea. Even if it's not your first baby, if it's your first baby in the US, it might be a good idea to take a childbirth ed class. And I guess you could kind of look at this presentation as a really brief childbirth education class, but there's some much more in-depth ones out there if you feel you need that. So some general guidelines when you're pregnant. It's recommended that a pregnant woman eat an extra 300 calories a day. You want to avoid sushi, which is uncooked fish. It is okay to eat cooked fish though, but also a reminder to not eat fish, a lot of fish that's really high in mercury, like tuna and swordfish. You want to limit your amount of that per week. You also want to avoid unpasteurized dairy products, so no raw dairy, just because of the risk of infection. Make sure fruits and veggies are well washed and meat well cooked. And the purpose of all these food guidelines is just to prevent food poisoning, because actually Listeria, the bacterial agent that causes food poisoning, can cross through the placenta into the fetus and cause issues. You want to drink lots and lots of water. Here in Phoenix, where it gets up to 115 degrees, I tell women, like 8 to 10 bottles of water a day. I think having a general guideline of like 6 to 8 bottles a day is a good one. And another indicator you could use is you want your urine to be like a light yellow, like a light straw yellow. If it's dark or orangey at all, you're definitely needing to drink more water. Exercise is encouraged. I get a lot of women that are told that they shouldn't exercise while they're pregnant, but that is totally not that's not true. There are, I will say, some things that would be a contraindication for exercising. For example, if you're experiencing preterm labor, bleeding, or if your cervix is if your placenta is covering part of the cervix, you wouldn't want to exercise. So it's important to talk to your doctor or midwife whether any of those pertain to you. But I do encourage women to run, walk, swim, bike. You can do squats, lift weights, go to exercise classes like Zumba and spin. And you just want to avoid, activities with a high fall risk. So here, a lot of women like to horseback ride, but I don't recommend that, because if you were to fall, that would be very detrimental to the pregnancy. But just, activities that are low fall risk, I would say. And exercise is going to help with back pain, constipation, fatigue, helps with a healthy weight gain, and also prepares the body for labor. Intercourse is okay to do during pregnancy, and it is normal to have a little bit of spotting after you have intercourse. Again, like I was saying with the exercise, if you're experiencing preterm labor, bleeding, or where the placenta covers some of the cervix, you wouldn't want to have intercourse, so it is important to talk to your doctor or midwife before you proceed with this. It is okay to travel until 36 weeks unless there's a high risk for preterm labor. But it's okay to get on an airplane, go for long car rides. Just make sure you do talk to your doctor or midwife before you go on trips, just so they're aware and they can give you the appropriate travel precautions. You want to avoid alcohol, tobacco, marijuana, and any illicit drug use in pregnancy. And I get this question a lot, but it is okay to dye your hair and get your nails done in pregnancy. So when to call the doctor / midwife or go to the hospital. So when you feel that you're having painful contractions that last for approximately 1 minute and they're occurring every 5 minutes or less for 2 to 3 hours, despite getting off your feet, taking a warm bath, or drinking lots of water, that's a good indicator of going to the hospital. A contraction just feels like, there's the Braxton Hicks contractions where the belly gets rock hard, but doesn't necessarily hurt. It's just a little uncomfortable, but it just is a sporadic tightening of the abdomen, and that is not labor. But if your belly gets really hard, you have period-like cramps, back pain, everything hurts really, really, really bad for about a minute, you have to, if you're walking around, you have to stop walking and kind of breathe through it, or if you're having a conversation, you have to stop talking and breathe through it. Those are contractions. And if you're having those every 5 minutes or less for a good couple hours, that would be a good indicator of labor. A gush of fluid, if you think your water breaks, that would be a reason to go to the hospital. Or sometimes it's not a big gush of fluid. It can also be kind of just this small trickle of fluid, but it would be continuous, and that would be a reason to go to the hospital. Bleeding like a period, that would be a reason to go. Like I said, after intercourse, a little bit of spotting is normal. And as you're getting closer to labor, a little bit of spotting is normal, and you don't need to rush to the hospital. But if it's bleeding like a period, you would definitely want to go. If you haven't felt the baby move despite drinking some cold, so if you haven't felt the baby move, so let me explain that. There's something called fetal kick counts. Starting around 32 weeks of your gestation, you want to feel 10 movements in a 2-hour period. So if you don't feel that, you want to drink something cold and sweet, I tell women. Lay on your left side and kind of play with your belly. If your baby plays back, then you're good. You don't have to worry about it. Baby's fine. But if baby doesn't play back or you still don't feel movements, then you would definitely want to go to the hospital. Other reasons you'd want to go to the hospital is severe headache that won't go away despite taking Tylenol, taking a nap, or drinking lots of water. If you were to have spots in your vision or persistent pain under your right rib. So all 3 of these are a sign of preeclampsia, which is a high blood pressure disease of pregnancy. And if it's not controlled, it can cause seizures in the mother and ultimately lead to fetal or maternal death. So it's very important that if you have these symptoms, you go to the hospital right away, or at least talk to your doctor to see if you do need to go to the hospital. For your hospital bag, I think a lot of women want to bring lots of stuff with them, but I encourage you to leave a lot of it at home because they do provide you with a lot of stuff at the hospital in the US. So you'd want to bring 1 to 2 outfits for baby. They do give you little tops for the baby and diapers. So really just an outfit or 2 for going home in or for taking pictures at the hospital. For you, you'd want to bring 1 to 2 pairs of comfortable pants and shirts, just kind of like stretchy pajama type stuff. You can stay in the hospital gown they give you, but it's kind of scratchy material, not the most comfortable, but the nurses will have to be checking your belly and your bottom, so you want to be wearing just kind of loose, stretchy clothing. You're going to want to bring your toiletries, just any favorite like hair or face products. They do have some general like soap, toothbrush, and toothpaste, but it's kind of nice to bring your own. Bring a phone charger. Any snacks that you like. The hospital does provide you with 3 meals a day, and a lot of times on postpartum units, they will come around and provide you with some snacks, but it's nice to have snacks that you like to have throughout the day as well. The hospital provides diapers and wipes, formula. For you, they provide pads, pads for bleeding, mesh underwears, any medications that you may need. They also provide supplies for baby's first bath. And for you, for your perineum, they provide spray and witch hazel pads, which are helpful if you had any tears. So what to expect when you go to the hospital. When you get there, you are going to get an IV. So it's a little needle that's put into the vein. The needle's taken out and just this little plastic catheter's left behind, but that allows you to get blood work drawn, get any fluids that you may need. Sometimes women need to get a medication called Pitocin to help with contractions. So that all goes through the IV. You're going to sign a lot of consents just about, whether you're wanting an epidural, in the event of a C-section, medications for babies. And there are interpreters at the hospital. Not necessarily a in-person interpreter, but a lot of times they have like iPads with a live interpreter that can go over those consents with you. You're going to be hooked up to a machine that will monitor baby's heartbeat, contractions, and your heart rate and blood pressure. So it's, depending on the way the baby's looking, sometimes you have to be on that monitor continuously. If baby looks really good, sometimes you only have to be monitored for a little while, and then you can get a break, walk around, and then an hour later they'll start monitoring baby again. Pain management options. So if you do feel like you need something for pain, there's IV pain medication that goes through the IV. These don't take away the pain completely, but they kind of just make you feel a little bit out of it. They make the pain not so bad. It takes away the really intenseness of the pain, but you still will feel pain. Nitrous oxide is, we kind of call it laughing gas. They give this a lot of times at the dentist, but in a different concentration. But this, you have to hold the mask yourself, but you inhale and exhale into this mask during the peak of contractions to help with the pain. But again, you still feel the contractions. The only thing that you you don't feel the contractions with is the epidural, and that completely numbs you, basically from like underneath the breasts all the way down to the feet. Depending on the heaviness of the epidural, some women can still move their legs, but usually the legs will feel really, really heavy, and you'll need assistance moving around in the bed. If you have an epidural in labor, you'll only be allowed to consume clear liquids, and a lot of hospitals won't allow you to eat in active labor, just because it's very likely that you'll throw up, which is really common as you get close to labor. And in the event of a C-section, they don't want you to have food in your belly, because for that anesthesia, they don't want you to have eaten. So kind of as you get further along in labor, just expect like maybe sips of water, ice chips, and then once you have the baby, you can resume a normal diet. If you're not dilating, you may have your bag of water broken, which is not a painful procedure. There are no nerve endings in the amniotic sac, the bag of water, but sometimes that is done. And then also Pitocin, like I was talking about. Pitocin is a medication given through the IV that can make contractions stronger and closer together. You need to get to 10 centimeters to begin pushing, and also even if you get to 10 centimeters, if the baby's still kind of high up in the pelvis, they might have you do something called labor down. So just allowing your body to kind of bring that baby closer down to the opening of the vagina before you begin pushing. If mom or baby are not stable or the cervix is not dilating, you will have a cesarean section. There's a lot of factors that go into this, so I'm not going to delve into that, but it is a possibility that you could have a C-section. But that would be a discussion with you and your provider at the time. Most hospital beds have stirrups attached to them so that they can support your legs. So if you have an epidural and you have really heavy legs, like I was talking about, these stirrups will kind of support your legs during that pushing phase. In the delivery room, typically you'll have your support person, so whether that be your husband. With COVID regulations or restrictions, there was only one person allowed. Now where I deliver, you can have two people, so women can have like their husband and their sister, for example, or their husband and their mother. But so at least one support person, a labor and delivery nurse, a nurse to take care of the baby, and then depending on the stability of the baby, you might also have a neonatal nurse practitioner or a doctor for the baby specifically. After a couple hours, you'll be transferred to postpartum. So once you're stable, once you can kind of walk again, if you've gotten the epidural, they bring you to postpartum. If you're a vaginal birth, you usually will stay at the hospital for at least 24 hours. And if you're a C-section, plan to stay for at least 48 to 72 hours. And then also on postpartum, you can expect to have some lactation support, so help with breastfeeding. Some warning signs of when you'd want to come back to the hospital. So this is after you get discharged from the hospital, you go home, and reasons that you'd want to go back. So if you soak through a pad an hour times 2 hours, that is too much bleeding. And your nurse will go over all this stuff when you're discharged, but just I wanted to go over these as well with you. So if if you get up and you have this big gush of blood, but it's just kind of like this one-time gush, don't worry about it. But if you continue to gush, that would be too much blood and you'd want to go back to the hospital. If you're passing large clots that are bigger than a baseball, so like bigger than this, if you pass one, I'd say just monitor. But if you continue to pass like 2, 3, 4, definitely want to go back to the hospital. If you have a persistent fever above 100.4 degrees Fahrenheit, so it's important to have a thermometer at home. If you have a sudden onset of pain anywhere in the body, that would be concerning. Severe headache that is not relieved with Tylenol, rest, or lots of water. Visual changes or persistent pain under the right rib. We had talked earlier about the warning signs of preeclampsia, which are those headaches, visual changes, and pain under the right rib. You can develop preeclampsia postpartum as well, so it's important to keep an eye out for these signs and go back to the hospital if you do develop these. Another warning sign would be if you were to develop a blood clot. And a blood clot would be if one of your calves gets really swollen, tender, hot to the touch. It would also be red in color. That would be a reason to go back to the hospital. After you have the baby, typically postpartum appointments, you'd be seen at 2 and 6 weeks postpartum. At these appointments, you're going to discuss birth control, make sure you are up to date on your pap smear, which is a screening for cervical cancer, and a postpartum depression screening. Quickly, just to go over postpartum depression versus baby blues. So it is normal to have some sadness after you have a baby, and this is referred to as baby blues. It's very, very common. Most women do experience this. It's kind of a combination of your hormones trying to stabilize, being sleep deprived, having this new baby to care for. It's a lot, and it can be really overwhelming. It typically begins 2 to 3 days after delivery and may last up to 4 weeks postpartum. It's characteristic of mood swings. You might be happy one moment, sad the next, crying over what feels like nothing, feeling very overwhelmed. You may have increased anxiety over the baby's care and have difficulty sleeping. So like I said, this is, very common, but typically this will get better kind of each day as you go along in your postpartum care. Now, postpartum depression, I tell women, is kind of like if your baby blues last longer than 4 weeks, that would be kind of concerning. Like if you're still, crying all the time, having these mood swings every day, past 4 weeks postpartum, that would be concerning for postpartum depression. It also is characteristic of lack of motivation to care for yourself or for baby, feeling numb, so you have no emotions, you don't feel happy or sad, and things that did bring you joy, now they don't bring you joy. That would be concerning for postpartum depression. You're unable to find joy in activities that used to make you happy. Thoughts of self-harm would be really concerning. Extreme irritability. And if you have a history of either depression or postpartum depression, you are at an increased risk of developing postpartum depression. And on this slide, new parent resources, there are some resources for you in your local community if you feel you do need some support for postpartum depression. If you have any questions, that is the entirety of my presentation. If you have any personal questions for me or directly that you would like me to ask, you can get my contact info from Jessie, and she can provide you with my email address, and I'd be happy to answer any of those questions for you. Good luck to you in your pregnancy and birth in the U.S., and I hope it all goes well. All right, take care. Bye.